During the early postnatal period, we aim to provide the best possible care to you and your baby to assist with the smooth transition to parenthood. If your baby is born in hospital, your length of stay can be from 24 hours to 5 days and may include early transfer home with the community midwives. The amount of time you would be advised to stay in hospital will depend on the type of birth and your recovery and how well your baby is feeding. The midwife will discuss your transfer home to the care of the community midwives or the public health nurse. We ask that you respect our visiting policy, with only your birthing partner able to visit you and baby, and this ensures mum and baby get as much rest as possible. Eating well and staying hydrated is important during the postnatal period. Your personal hygiene and wound care is essential in the postnatal period to keep you and your baby safe and well. The midwife will examine you to assess you are well and recovering both physically and emotionally, and support you and your baby as you transition to motherhood. Referrals to specialist services such as lactation and physio will be completed during your stay in the unit. Before discharge, your baby will have a series of discharge checks, including a hearing screen, baby physical check and a weight. We will notify your public health nurse of the birth and ask you to give her your discharge summary along with your GP. Your public health nurse will visit you in the first 10 days after birth, and the GP should see you at 2 weeks and 6 weeks.
Hi, my name is Miriam and I work in the Mama Postnatal Hub team in St Luke's Hospital, Carlow, Kilkenny. Mama Postnatal Hubs is a support service for mothers and their partners or support person from the moment your baby is born until your baby is 6 weeks old. It is available not only to the mothers who had their babies here in St Luke's, but to all the mothers living in Carlow and Kilkenny. We are somewhere to go, someone to ask, and we are available 7 days a week. We are a team made up of Imelda, the manager, midwives Anne, myself and Vicky, and our physio Shirley, who specialises in women's health. We offer a broad range of services in both Carlow and Kilkenny. There is a phone line to a midwife 7 days a week for any non-urgent questions or concerns. Or book an appointment for a Mama MOT, which is a full head-to-toe check like you had in hospital every day. A feeding focus for a feeding assessment and support, whether you are breastfeeding, bottle feeding, expressing or a combination. Or book a parent craft session to recap on all the baby basics like bathing, skincare, winding and safe sleep. We also have options for a What Happened session, a listening service if you wish to reflect on and explore your birth experience with a midwife and your chart. Similarly, a Let's Talk About It session to reflect on your birth experience but without your maternal chart. Ideally, these sessions will be done after 6 weeks. We also run a number of group sessions every week, including our Check, Chat and Coffee in Kilkenny every Wednesday and every Thursday in Carlow. For more information, follow us on Instagram at Mama Postnatal or on Facebook under Mama Postnatal Hubs. Mama sessions do not replace any appointments you may have with other professionals like your GP or public health nurse.
Congratulations on the birth of your baby. Some women may have stitches to their perineum following the birth of their baby. We encourage you to have a daily shower. Wash your body with a small amount of pH balanced non-perfumed shower gel, only enough to lather under the armpits and breastbone. Nothing but water the rest of the way down. Take the shower head down, turn down the pressure and the temperature and allow the stream to wet the perineum. Dry your body thoroughly. Using disposable paper towel, pat the perineum and dispose of same. Take fresh paper, pat the back passage. Repeat those steps until the area is completely dry. Change your sanitary towels every time you go to the bathroom and more frequently if needed. Clots can be reasonably normal, but if you pass any, inform your midwife to inspect the clot before disposing of it. In between showers, we advise you to take a glass or a bottle of water into the bathroom as you pass urine. Wet the perineum, this will help keep the area clean. The stitches will dissolve themselves over 5 to 7 days. Take regular analgesia if required and change the sanitary towels regularly. Congratulations on the birth of your baby. When a lady has had a caesarean section, she has a special dressing over her wound. Here in Mullingar we use 3 types of dressing. Honeycomb upside dressing, this is waterproof and will be removed prior to discharge from hospital. Pico dressing, this is also waterproof but includes a vacuum function which promotes healing and reduces the risk of infection. And the Prevena dressing, similar to the Pico but a different brand. Your dressing type will be dependent on a number of factors, including previous history, BMI and individual concerns. We encourage you to have a daily shower whatever dressing you have. Wash your body with a small amount of pH balanced non-perfume shower gel, only enough to lather under the armpits and breastbone. Nothing but water the rest of the way down. Despite having not had a vaginal birth, it's important to perform perineal hygiene and change your sanitary towels every time you go to the bathroom, and more frequently if needed. Dry your body thoroughly. Use a separate towel or paper towel to dry the wound. If your dressing needs replaced, your midwife can help with this. Pico and Prevena dressings will remain on until day 7 when the public health nurse will remove. You have stitches to the skin which will dissolve 10 to 15 days, but remember, you've stitches on the inside which can take up to 6 weeks to heal properly. Invest in yourself. Continue daily showers as described above. Take a postpartum multivitamin and remember to continue your iron supplement. We would encourage you to have a well-balanced and nutritious diet. Include exercise as described by the physiotherapist. Wear loose-fitting clothing, nothing rubbing against the wound itself. Look out for the typical signs of infection: redness, swelling, and an offensive odour or discharge. Seek medical help if you see any of these signs.
Hello, my name is Caroline Harrigan and I'm a pelvic physiotherapist. I'm going to talk you through how to carry out your C-section massage. Within the first few weeks, the most important thing is to let your body heal and get it back to normal movement in and around your C-section scar by standing up tall, taking big belly breaths and doing gentle pelvic tilts forward and back. When your wound is healed between 6 and 8 weeks, you can start to massage around onto the C-section scar depending on how you feel when you touch it. To carry out your C-section massage, use a cream or oil, non-perfumed. Begin in a comfortable position in lying on your back with your knees bent, well supported with pillows. Using 2 fingers, gently touch above and below the scar to see how it feels before moving directly onto the C-section scar itself. Then carry out massage in 3 different directions for 1 minute. In circles, up and down and over and back. The edges of the scar may take longer to heal, as that is where they carry out the double knot and this area might feel a bit stiff and tight. If you feel the area is very sensitive, only use light pressure and get the area used to being touched by different textures, like rubbing cotton wool over the scar and a towel to help desensitize the scar. If you feel from carrying out advice and you're not healing and have issues with pain or any issues with the scar, please contact a health professional who can refer onwards to get you assessed if you're worried.
Under the maternity and infant scheme, your baby is entitled to 2 revisits after the birth called the 2 and 6 week checks. Both yourself and your baby will be checked on the same day for the 6 week check. When booking this appointment, it is a good idea to inform the receptionist what the appointment is for, so that your baby can be registered on the system in advance of the visit. The 2 week check is usually a very short visit. It's just for your baby and will be done by either your GP or practice nurse. The main aim of this visit is to weigh your baby and to listen to any concerns that you may have. The 6 week check is then a more thorough examination of your baby from head to toe. Your GP will initially ask you if you have any concerns about your baby and will ask specifically about feeding. Feel free to bring up any worries that you may have during this appointment. Your GP will give you general advice on feeding, weaning and vaccines. Your GP will then examine your baby. We will examine baby's general appearance, heart, lungs, eyes, hips, reflexes, weight, and we'll do various measurements. If you have a baby boy, we will check their test days and will ensure that they are in the right position. If any issues arise or if your GP has any concerns, they will discuss this with you and make a plan. Once this exam has been completed, a baby can then proceed to have their first set of vaccines. These are usually given by the practice nurse. Your GP will then proceed to carry out the 6-week check on yourself. This is a really good opportunity to chat to your GP if you have any concerns or worries about yourself or about how the newborn phase is going. They will ask about the birth itself and establish whether you had a vaginal delivery or a cesarean section. They will ask about your birth experience in general and will explore any concerns that you may have around that. They will ensure that you have good support at home and are not displaying any signs of postpartum depression. If you are struggling emotionally or are feeling anxious or depressed, it is really important to chat to your GP or public health nurse about this so that they can support you through it at an early stage. Your GP will inquire about whether your periods have returned and will offer you contraception at this visit. They will explain the options available to you based on whether you are breast or bottle feeding at the time. They will also remind you to stay up to date with your cervical smear tests. Your GP will likely do a physical check including your blood pressure, a urine test. They will ensure that your womb has reverted back to its pre-pregnancy size and will finally check that any vaginal tears or episiotomy wounds are healing well. If you've had a cesarean section, they will check the wound for any signs of infection. Again, this is a really important visit for you as a mum and for your baby, so feel free to ask your GP lots of questions if you have them. And I wish you and your baby the very best.
For new mums, contraception may be the last thing they are thinking about, but it's possible to get pregnant as soon as 3 weeks after you've given birth. Even if you're breastfeeding and your menstrual cycle has not returned to normal, if you are sexually active after having your baby, you should be using contraception, unless you are keen to get pregnant again. It's normal for midwives and hospital staff to ask you about your contraception plans soon after you've had your baby, and you can bring up the topic of contraception at any time with your midwife, health visitor or GP. The choice of contraceptive methods should be initiated by 21 days after childbirth. Some methods of contraception can be initiated immediately after childbirth. For example, the intrauterine coil, IUS, and the progesterone-only implant, the BAR, can be inserted immediately after delivery. The insertion of the implant soon after childbirth has been associated with high contraception rates and a reduced risk of unintended pregnancy. Emergency contraception is a backup contraception that can be used to avoid an unplanned pregnancy after you have had sex without using contraception, or if your method of contraception has failed, condom slipped or missed a pill. You can use emergency contraception up to 5 days after having unprotected sex. There are 2 options: the emergency contraception pill, known as the ECP, or the copper coil, also known as the postcoital IUCD. You do not need a prescription for emergency contraception. You can get this directly from your pharmacy. If you have a medical card, you can access it for free from your pharmacy. Discuss with your GP or pharmacist, or for more information, visit www.sexualwellbeing.ie.